Well, let's get some more analysis, and we can speak now to epidemiologist Antoine Flahault, who is a professor of public health and the director of the Institute of Global Health at the University of Geneva. Thank you so much for speaking to us, Professor. There's a lot we could be talking about right now, lots of things happening. But why don't we start with this news about vaccines being recommended here in France for children between the ages of 5 and 11. How useful do you think that is as a step?
Yes, I think it's an excellent news. It's a very important step now to vaccinate children. We have an experience, thanks to the Americans. In the USA, more than 5 million children have been vaccinated at this age, 5 to 11. So we know that the vaccine is safe, the vaccine is effective, and it is important because there are now many cases, even in France, of children in hospitals. So the disease is not so mild, even for children. There may be also some casualties. So protecting children is absolutely essential today. And of course, if it also can contribute to protect against the Omicron wave, it's very welcome.
Yeah, we keep hearing about the Omicron variant and people drawing some early conclusions about it. They say it's more contagious, but it seems to be less deadly. I mean, do you agree with those conclusions, and do you have any of your own?
For the transmissibility, the contagiousness, it is completely sure that this Omicron variant is more transmissible. So for that part of the knowledge, it's quite certain and consensual. Regarding the severity, I would be more cautious, because when a new virus emerges, usually it attacks more often the young people, the young segment of the population, those who are traveling, those who are meeting, and these are not prone to be hospitalized and to develop severe forms of the disease. So we have to wait a bit more, and in addition to that, it may be counterbalanced by the high transmissibility. If you have 3 times more transmissibility with the Omicron variant, then even if it is the severity is a bit decreased, it may produce a higher number of hospitalizations and casualties.
And Professor, you of course know viruses better than anyone, and they have cycles, don't they? Sort of a life cycle. And I'm just wondering whether this, and different phases, would you say this is perhaps a new and final phase for the COVID-19 virus?
Oh, we always can hope, but we cannot predict. And, we try to forecast the disease in all countries in the world where we have data, and our predictions are only reliable in a perimeter of 7 days. So beyond 7 days, we are not able to predict. So I'm not able to tell you if it is the final phase or not.
But would a virus typically weaken as it was coming, drawing to a sort of a conclusion?
There is no real definite patterns of virulence and transmissibility. Yes, transmissibility, we can say for sure that when a new variant becomes dominant, it's because it is more transmissible than the previous one. It's the reason why it's selected. But regarding the severity or escaping to vaccine immunity, it's not something which is obvious. And you see, for instance, for influenza, there are new variants each year. They are not less or more virulent.
And of course, right here in France right now, we've got the situation where, as we heard in that report just before you, Delta is currently at the peak. Plus, we've got Omicron appearing on the scene and likely to spread at, as the Prime Minister said, at lightning speed. Is it dangerous to have two prevalent variants in tandem like this?
Yes, as it has been said during the previous speaker, it's the bad situation to face a new wave when you have not finished the previous one. So usually we had a sequence of waves, and it was almost flat, almost at the minimum when a new waves occurred. But now we have the conjunction of these two waves. It is seen in the UK or in Denmark, where they are facing facing these Delta waves, which was not finished when they experienced the Omicron wave. So in a way, we can see what is happening in Denmark and probably see that is the case. That will be the case in the coming weeks in France or in Switzerland.
But I mean, we don't need to be too pessimistic, given that our arsenal for dealing with COVID-19 seems to be improving all the time. The protocol for dealing with COVID patients has improved. The drugs for treating COVID have existed, and they didn't exist a year ago. Plus, we now have a fifth COVID vaccine here in Europe, which has just been approved today, the Novavax vaccine. Does that give you optimism?
Yes, you are completely right to say that, because we can see that we have experienced very big Delta waves in Europe, and in Western Europe in particular. The morbidity in hospitals and the mortality was much, much lower than in the previous waves. So we have succeeded, maybe not completely to fight the COVID today, but we have succeeded at least to control its burden on, and the overwhelming of the healthcare systems did not appear in the past summer and in the past months anywhere in Europe. Of course, some countries like Austria or now the Netherlands are obliged to lock down again for a couple of weeks because of a risk of overwhelming. But at least in France, in some countries also, we can see that there is a strong reduction of the mortality and the severe morbidity due to the vaccine, and particularly to the third dose, which make the full shame vaccine, which is really effective against the virus. And you were right also to talk about the new drugs. There are some new drugs and of course new vaccines also, but the new drugs are also promising in fighting severe forms of the disease.
And just lastly, Professor, anyone who's watching who, a responsible citizen who's going to go ahead with some holiday season festivities, but they want to do so with the maximum of caution. They might want to test their friends before they show up. We're all jabbed. People are wearing masks. The room needs to be ventilated. Any advice, or would you simply say avoid gatherings at all costs?
No, we need to live, and we live with this virus for months, for years now, so we need to have also vacations and to meet friends. That's life. But we may secure a bit these meetings, these parties. We may try to reduce the risk by, as you said, by testing more, by ventilating. It's only a virus which is transmitted by aerosols in indoor settings, which are poorly ventilated and crowded. So if you avoid at least to be poorly ventilated, if you test, if you use masks when you do not eat or when you do not drink, if you are vaccinated with 3 shots, with 3 jabs, it's something which may decrease dramatically the risk of transmission.
Okay, well, thank you for sharing those thoughts with us. Professor Antoine Flau in Geneva, thank you very much indeed for speaking to France 24.